And yeah, we're a little bit late, so I hope you will not go out and rush out to lunch. I hope you can see the screen. You can. That's perfect. I'm totally independent or dependent on technology, wireless technology, so you may have me excused. Anyhow, this is my hero. He made this vision many, many years ago, and if you already have implemented full-scale telemedicine in Sweden, then I will stop talking. If not, then I will continue with introducing that I'm vice-chairing the Continua Health Alliance, which is a part of the Personal Connected Health Alliance formed by HIMSS and the mHealth Summit. It's recently formed, so we are also now under these umbrellas. I work for Delta, and Delta is not an airline, however you came. We will not take any responsibility for your tickets. We do microchips. I don't want to explain our processes, how we do it, our production facilities, but it pretty much starts like this, and then we have millions of that. We put them in like this system, so when you go to Denmark, we actually made the stuff inside for a Swedish company. That's how we work. We also help Danish hearing aid industry to miniaturize stuff. And now you see you on Twitter, that's perfect, I can see that here, so please tweet. We test products, and this is a very good way to know how products actually fails a lot. We know that. This is a user panel. It's actually totally outdated, so don't think it's for real. It's just for fun. We have 70 torture chambers. Then we do electronic sketching, where we fast can do a prototype with users and then end up with something we can test out pretty easy. We put them in intelligent packaging, where we can put it down to a little microchip. But before that, we'll do processes like that. For that microchip costs €1 million. Some of that we put, and I hope you love our efforts. For a Norwegian company, we do this for BMW, a system that can see the moose on the road. And I was looking out for that this weekend. Anyhow, you know the challenge. I can just say that we all look like Usain Bolt until 50 years ago, and then something came along, Mac Diabetes, commercialism, building body fat, or whatever they're called, these brands, that is all over the world is filling us with bad food, or maybe it's the technology like we do. I don't know. At least I know that all the kids now is looking like that on your holidays. If you do not agree, if they have no Wi-Fi, what will they do? So world is changing, you know that. When I go to the US, the magazine you can take down from the shelves called Money and Private Economy says you should invest in the US, invest in diabetes medicine, novel stuff like that, because this is a progression for the US. They haven't learned it yet, apparently. So 9 out of 10 will be obese. This is grotesque. So now Nike changed this guy with a new role model, because if 9 out of 10 customers is obese, you need to find something you can identify yourself with. So this is the new role model for the future. So you know the challenges. But I've been working before I was in Delta a long time with healthcare, and innovating healthcare systems is pretty much coming like this. I'm a tech guy, I know that. I'm sorry. I think that, to be honest, when I look into the health system in Denmark, maybe also in Sweden, around the world, it looks like a massive traffic accident. Actually, going back to my car, I know exactly when my car has a failure. Do you know when your body has a failure? Do you know it? Do you want to know that? Do you want to know from your screen, hey, there's a moose ahead of you? I don't want to have a moose in my front screen, do you? Nobody wants. Anyhow, I just went to Sweden this weekend, trying to avoid rain showers. I took my little son. We were out canoeing in Isaberg and out climbing. But why am I talking about my son? Because, yes, my son is actually a little bit of a, let's say, how I experienced the Danish healthcare system, because he got diabetes 3.5 years ago. Nobody has it in our family. We do not know why. Nobody knows it's diabetes 1. Nobody do much research on that. It's all in diabetes 2. Anyhow, well, what good could come out of it? Yes. At least I now had a son that is a chronic care patient. I know some of you look at his white hair and his pink jersey, but he is a boy, but I don't know how to cut his hair. He doesn't want to cut his hair. If you have any, just come afterwards. The jersey is pink. It's a Palermo jersey. It says Mikuli in the back, okay? So any women out here that know what to do, tell me, please. But, okay, I come from Denmark. We are advanced with ICT, with health systems. Unfortunately, I'm in a part of the health system in north of Copenhagen where they just didn't get it yet, so I got a China book and a pen as a tool to manage a kid's diabetes. We are talking about a kid that can face blindness, amputation, ulcers. He needs to be on the right level of glucose now. Everything has changed in his life. It is such a simple value. I just want to know if he's above 15 or 140, I think it's on another scale. He's right now in school. I don't know if he's playing somewhere in the schoolyard. Nobody sees him. He gets his second hypoglycemia attack. He faints, he dies. Nobody can tell me, not even he's smart, he has an iPhone. It cannot communicate with him. It's such a simple thing to see that his trend is going down. So I tried to change this simple glucose meter. I need to buy this glucose meter because I get reimbursed by the Danish municipality and they only approve stuff that is cheap and do not communicate with the health system. There's 25,000 kids in Denmark. Put that up. Everybody who has parents with kids, put them in too high in school with their blood glucose. We just need the peace of mind because we can't get it. So I put him this one, 2 + 1 is from Slovenia. I thought, okay, maybe, and I've bought this weight scale and also have this pulse because now I'm trying to do some tracking myself, get back to that. But can it communicate? Not at all. It can send an email to me, that's it, but it doesn't work. Text message doesn't work. In the hospital, he comes constantly every 3rd month. But actually, I wonder why. Do we have so much money in Scandinavia that we need to take, let's say he's always on the same level. He's not going like this in his blood glucose. He is actually quite well regulated. So don't put him in. Take the use of the efforts of the people that cannot manage the glucose because they will get in the long term sick. No, they put in a long-term measurement. They don't look in the China book. And this is how they write down. And I have all these data. They don't care. This is the treatment of today in Denmark. It is the treatment of many, many, many people around. So when I say that the healthcare system is doing square wheels, I actually mean it as a user. And it's so simple to change it. How do we do that? Okay, let's take another example. That's my blood pressure. I take that. I'm 49 years old, I admit. I have nothing to hide. I stopped smoking because it's not, you can't stand with a cigarette and tell your kid to eat a carrot and drop candy. So I didn't. I still have the red wine, but I killed the cigarette. So my weight went up. So I said, hey, okay, I take my butt to Berlin with my colleagues. I did. I made it on a mountain bike. And you should not laugh at a Danish guy saying he has a mountain bike. All Norwegians and Swedes say it's a hill bike. But they call it a mountain bike when I buy it. Okay? So, thank you. And you see, actually, it's also, maybe it's genetically unfair, but I have a resting pulse that's way too low. My blood pressure is good, and now my weight is going down again. So, I share it. Nothing. I have my body fat, everything. You can see it. I'm showing it to you. I will share my data. I allowed myself to share my data. But could I share it with my health system? Actually, they ask for my blood pressure right now. Because I take a pill, they want to check. And this is what I get up. So they write down on paper. So now we have another traffic accident. Think about that you could get all these data. And all of this world is now changing. Do you want to put, like you put all your music in iTunes? Do you want to have that business model with Apple now going in with the health kit? I think it will revolutionize the stuff. So when we go to Apple, and together with IBM and other partners in the Continua Health Alliance, to sell interoperability, and I think it's difficult to come and say, hey, you guys, why should we have data that can be exchanged and not put in silo solutions? But we need interoperability. We need it because that's how we can advance and scale up solutions that can be used safely in a system. This is one way of saying it. If you don't know what interoperability is, let me explain it. What we do in the Alliance, we are like 160 companies around the world and organizations that tries to get devices to communicate in 3 domains. I don't want to go in details with that, but it's mostly devices. So we try to do, not to make standards, but to select the standards already out there or try to modify them in the standardization bodies to get all the data. This is boring, I'm sorry, one boring slide. But get all the data from this side into the health system so that Cerner, so that the doctors and the clinicians, the patients or the caretakers can actually have a secure access. They cannot offer that in the health kit. But it can probably promote that we get more focus on this. So this is what we are doing. So we certify products that do that. So let me show it with a little example, because I can talk about this, but it's much more fun to actually do something that, if you don't mind that I take my clothes off. It's okay? You're not running? Is it okay with you also? Good. So here it is, 15 grams. And I will now go out, and I will go to this one. And now you see a live stream of my ECG. It's low power Bluetooth. It's FDA approved. It's Continua ready, and it's CE mark class 2. This is a Holter measurement device. I can wear it for 3 days. It's on the market, not in Europe. If you don't believe it, I can try to see, is it working? Yeah, I'm lying now. So my pulse is now high. If I jump, it will probably get up. Yeah, I got up a little bit. It's good. You need to exercise. So this is, isn't it amazing? See, you just push this, and then you find the sensor like this. Comes up in a minute. That's what you need to do. Is that complicated to implement, to show to a patient at a hospital that has a heart arrhythmia case? Or you can find other use cases for this. This is a white label product. We don't sell it. You have to buy it some else. We are like a semi-public institution, but we do this in Denmark, just across. So let's get back to the presentation. I hope the technology works. Yes, it does. Come on. So why do we do this? And I button up my shirt again. I'm sorry for showing more of myself, but I need it. Otherwise, we can't change the world. Of course, think about my son sharing all his data, what he eats, his activity, everything. I have now walked. I have my pulse, my SpO2 on this little one. And we can put it in the cloud. We can share it. What are they eating? Find out why is he still, after 3.5 years, in his honeymoon? Why is he still producing his insulin? Nobody knows. Something with food. So in my opinion, if we can do this now, why don't you make this U-turn? Why don't we stop working? You know, when you go to the hospitals, I just go, sorry, I have to turn my iPhone this way. Sorry, coming back. What I think we should do is take a U-turn, and then maybe you build a new Karolinska hospitals, but as you told us, in Denmark, we took out the hospitals. We do that in Denmark now. We want to change this. Get away from the old-fashioned way of doing a Toyota lean hospital system where you're put in a production line. I can say nothing positive about coming into that car shop, fixing my car. But when you do it, you're pretty good at it, but you don't care much about me as a patient. You give me some very, very bad food. I actually, you can say, play the hospital food bingo if I'm not dead by any kind of disease because you cut down on cleaning. Yeah. I don't want to stay at a hospital, I have to admit, and the technology is ready out there. We just don't grasp it. It's actually approved, ready. It's the mindset we're working with. And everybody in this world is looking to the next supermodel. It's us, dear guys. It's Scandinavia. So, and we have suffered the same diagnosis of what Jules Verne was talking about 120 years ago. We're still doing it. I also did a presentation in Turkey. That's why I have female pilots with Turkey, probably combating. So in Denmark, I persuaded my health minister. Now she's gone. It's politics, but she still did it, to make a telemedicine action plan. And they decided to implement, which is quite new, to make this, how can we get away from all these pilot projects and scale up our solutions, scale up my solutions, scale up my son's solutions to manage his diabetes. And we need to do something, and the only way to do it is to implement that reference architecture that is now in Denmark called Continua Health Alliance. It's guidelines. I know it's complex, but it's how to get these data securely in. So they have done it, and And we now do a test center, test facilities at the new hospital in Odense, where you can come and check out new solution. We call it now CBOE. But it's because in Scandinavia we have tech-savvy, a lot of users. They want to develop solutions, and they have money. And even though we are a little country, we are interested. Many big companies are now coming into Denmark to test out and scale up their solutions, because maybe we are little in numbers, but in numbers of using technology, we are very big. So sorry for the bad language, but it helps explain. Good part, Norway took an active lead. Finland is taking a decision, and Sweden, after I was at the Almedalsveckan, and it's very positive, the signals coming out of there. You can ask Daniel Forslund, he was there as well, if you know him from Vinnova. So it looks like we have a Scandinavian market. Norway mandates now continuous certification for products, so we can get the data in and out of the systems. So, ending up, if you want to think about how you're going to change the future, think about what Gandhi said. It's a pretty simple thing, but what happens to me now is that my fridge will communicate with my Wi-Fi-enabled weight scale and probably tell me that electronic ink on my beer is passing that scanner saying, hey, you should not take it. But you can also go to the fitness center if you don't want to do it that way. Don't do it this way. If you want to take your dog for a walk, don't do it this way, please. This one we made to make fun of you Swedish people, because every evidence says that if you eat 6 vegetables per day, but you know the word 6, it's not good in Swedish, so you change it to 5, so we made this commercial, but it is 6. Have to tell 6, okay? Not 5. So funny, you Swedish. So, play some football. If you do that, you can go at the beaches of Denmark and be happy with your best friends. Live like you're 150, not remembering anything of what I said today. If you agree, please tweet. Thank you very much.
Thank you very much.